tailoring the needs of the community to develop your solution?
Sure. So, you know, first and foremost, it's working with the community leaders, you know, and they're the ones, or the patient advocates. So, one example was in New York City, CDC Cares is an organization of all the behavioral health providers in New York City, and they had a challenge called I Choose, where they brought in vendors all over the country, and then they had patient advocates select the vendor of choice for helping and addressing the community the needs that the community had, and for those individuals who had severe and acute mental health issues. So part of that is just starting from the beginning and getting the input from the community and the patients themselves. And then even while we were deployed, when we were in Arizona or even in Kentucky, for example, I think I actually even talked to a patient. One time I got a call from the case manager, and there's a patient that wants to talk to you on the phone, and I'm like, what? And usually those are not good calls. So I'm like, okay, and I'm just bracing for it. And she's like, okay, I'm ready, I want to go to the next level. And this was a person in the underserved community and who was so inspired to take care of their health that they wanted more. They wanted to do more. So I think getting the feedback continuously, just like when you build and iterate, you get feedback continuously. We also have formal processes in place as part of our product development. Clinicians also, right before we built anything, we talked to a clinician, help us understand the mindset of a patient who's having behavioral health challenges, right? And what is that like? Because one of my biggest pet peeves about anybody building health solutions for anybody, but especially underserved communities, is we're not empathetic to the end user. A patient is compromised, not just physically compromised, emotionally compromised, financially compromised. If you don't really put yourself in their shoes, you end up with solutions that are just more work. And that's not what technology is supposed to do. So I think just starting, talk to people who work with patients, talk to patients yourself. When I was in the clinic, when we were deploying, I would sit in the lobby and I was looking and talking to people, and I'd look at their phones. And I didn't even know this. This is actually I did not know how many games were on a phone of someone in an underserved community in the United States. They play a lot of games. So, and I was just surprised. It was a big revelation to us that we could actually reach this community with this medium. So, getting out there, having an open mindset, but getting feedback, talking to people early that work with patients and talking to patients themselves. So,
thank you so much for that. So I have a